Hello students, Instructor Pamela here. I would like to give you a brief overview of your Evaluation and Management section within your CPT book. Now keep in mind, the ICD-9 book, the CPT book, and the HCPCS books are all reference books, which means all of the answers are in the books. You do not have to memorize a thing. You just match from what the doctor dictated and then what you are actually picking from the code descriptions. So your Evaluation and Management is also called E&M codes. They are used in physician offices from your 99201 to your 99205, for example. Also your E&M codes are the 99,000 series, so every time you see a 99 code, you are working with a E&M code. Excuse me, I had a little technical difficulty there with the cord button. Also keep in mind, the E&M section is the smallest section within your CPT book. So with that being said, the Evaluation and Management section houses inpatient and outpatient coding. If you begin to look through the E&M section, you'll see neonatal, you'll see inpatient hospital rounds, you'll see emergency room, you'll see skilled nursing facility, you will even see, what else do we see in the E&M section? There's so many areas within the E&M section. But again, inpatient and outpatient. So where this comes in as a coder, when you ask yourself, who am I coding for again? If you are coding for a neonatal facility or a department or a unit within a hospital, then you're going to be utilizing those neonatal codes. The rule of thumb in coding all across the board is that you always need an ICD-9 code or an ICD code in general, whether it's ICD-10, 11, 12, 13, 14, whatever we transition to, that's what it'll be. So that being said, you always need a diagnosis to support whatever services that you are choosing from the Evaluation and Management section. All doctors' offices use E&M codes. They create an accounting form where they basically provide the services or list the services that they provide. And then they check off the services that was given to the patient during being seen. And then the accounting form is passed on to the biller or the coder, and then they put that charge in the EMR or the EHR. Now also know in your CPT books, there are your E&M tables. They help you to determine if you're choosing the correct levels of services, and this is where it comes in as a coder of learning the E&M part with your 1995 guidelines as well as your 1997 guidelines. Each facilities are different. They will tell you what guidelines they prefer you to use when you go to the job, but either way, do know that they help you ensure that you are choosing the correct level of services. And again, that's based on the physician's documentation and what the physician performed or did perform during rendering services. For example, if a patient is diabetic, there are particular services the physician must do to determine if the patient's diabetes, if it's stable or unstable, such as taking off their socks and evaluating their feet. And if that's not done, that level of service can't be assigned because the physician didn't do that. So again, your CPT book helps you with all that information. Also in your Appendix A, they provide thousands of different scenarios of what to encounter in Evaluation and Management. But just remember, Evaluation and Management houses both inpatient and outpatient services. It just depends on where you code as a coder when you're in your upcoming jobs in the future. But always know, all outpatient is billed on your CMS 1500 claim form. It needs a CPT code or a procedure, service or procedure, and it needs an ICD-9 code always and forever. And with that being said, I hope you enjoy this little information on Evaluation and Management. As always, journey well. Until next time, Instructor Pamela. Take care. Bye-bye now.